Thank you for joining. I hope that you are doing well. Eye exam might help spot poor circulation in legs. Narrowing of blood vessels in the retina could mimic what's happening in your lower limbs. Could a routine eye exam someday point to trouble with circulation in the legs? New research suggests it might be possible. Researchers at Johns Hopkins University in Baltimore said changes in the eye's retina may help spot people at risk for a narrowing of the large blood vessels in the legs, a condition called Peripheral Artery disease, P.A.D. P.A.D. is estimated to affect approximately 8.5 million Americans above the age of 40 years and is associated with significant morbidity, mortality, and quality of life impairment, noted one heart specialist. The new study was led by a Hopkins research team investigating almost 9,400 adults who were tracked for 19 years. During that time, more than 300 developed P.A.D. that required hospitalization or a procedure to open their narrowed leg arteries. After adjusting for common P.A.D. risk factors such as diabetes, the researchers found that people with abnormalities in the tiny blood vessels of the retina had more than double the odds of developing P.A.D. and nearly 3.5 times the odds of developing its more severe form. The link between retinal problems and P.A.D. was strongest among people with diabetes, the researchers added. Why the link? According to the investigators, abnormalities in tiny blood vessels, as evidenced in the retina, may point to bigger problems in the legs. In the lower limbs, damage to small vessels could impede wound healing or the creation of new routes for blood to flow around narrowed leg vessels, and that could lead to more severe P.A.D. He agreed that the notion of spotting small vessel trouble in routine eye exams has merit. Looking at the back of the eye's retina can be done in primary care offices as part of a routine clinical exam, he said. Hopefully one day, a look at the eye will hold clues to the future of the legs, which will be an alert to the heart outcome and a signal to start effective prevention and treatment. The chief of cardiology agreed that P.A.D. can be a silent condition that's tough to spot early. But this study confirms that retinal evaluation and imaging can find this disease when it is in a silent but treatable phase, he said. If more patients had regular eye examinations and atherosclerosis was found, early treatment could save their lives, he said. Because the findings were presented at a medical meeting, they should be considered preliminary until published in a peer-reviewed journal. I will post a link for this article in the description. Thank you for watching. Good day and good health.